Okay. Well, good evening, everyone. Thank you so much for joining us for our COVID-19 vaccine webinar, What Cancer Patients and Survivors Need to Know. My name is Noel Larkin. I'm the director at the Office of Cancer Health Equity and Community Engagement at Karmanos Cancer Institute. And we are excited to work with all of our partners, Rogel Cancer Center at Michigan Medicine, Gilda's Club Metro Detroit, American Cancer Society, and Cancer Support Community of Greater Ann Arbor to bring you this webinar this evening. So today's webinar will be recorded. It will be available to the community, and presentation slides will be sent out to the email address you used to register. That will probably go out tomorrow morning. So you'll have access to the slides as well as a recording of the webinar. So how to ask a question. You can ask a question at any time throughout the webinar by typing your question directly into the chat box. We want to remind people, if you do get disconnected, we all know sometimes this happens, you can use the same link that you used to get back into the webinar. So just hop right back on. All right, so we have a couple poll questions for everyone before we get started. So I'm going to actually call on my friend Chris here to launch a poll, and we ask everyone, these are anonymous questions, so your name won't be recorded with these. We'll ask Chris to launch the first poll question, please.
Noel, could you please launch the poll? I had just an issue with the link.
Okay.
I apologize.
Oh, no problem. So we'll give people a few minutes just to, oh, I see people are filling it out. We'll let folks complete the poll, give about a minute or two. I can see that a lot of you have already been vaccinated. Okay. All right. Maybe I'll give you a couple people voting, maybe 20 more seconds just to finish that up. Okay. All right. Oops. Okay. So I'm going to, oh, sorry, everyone. Sorry, I'm having some technical problems here. Okay, let's move on and introduce our first speaker. I'm excited to introduce Dr. Sanjay Revankar. Dr. Revankar is a professor of medicine and the director of the Infectious Disease Program, a fellowship program, and also the division of infectious diseases at Wayne State University. He's also an infectious disease specialist with Karmanos Cancer Institute. So feel free to welcome Dr. Revankar.
Great, thanks, Noel. I appreciate the invitation to talk about something that's obviously very topical nowadays, COVID-19 vaccines, and in particular cancer. And I'll share, what we know so far and what the general recommendations are. I'll just kind of preface that by saying that I know we got a lot of questions from individuals, and some of them are pretty specific, and I probably refer to your physician for that, but we do have some guidance that we can give to patients. So next slide. So a couple of points I want to start with, and at the beginning, and this was actually mentioned one of the questions, is what do we know about these vaccines and cancer? And I guess the main issue or problem there is that the COVID-19 vaccines have not been studied in patients with cancer or immunocompromised conditions for the most part. There's a very tiny number of patients that ended up being in these conditions that were in the original trials, but for the most part, there were no large trials because the concern was with how those patients would respond to the vaccine. So the second point is that vaccine effectiveness will likely be decreased in cancer patients, especially those with hematologic malignancies. So that may sound like a very general statement, but that's about as much as we know right now. There are studies ongoing to try to understand what different types of cancer and therapies can affect the response to these vaccines, but we don't really know very much at this point. Even though we've vaccinated many millions of individuals, the studies in immunocompromised patients are just really being done. So we think that it'll likely to be decreased, but we don't know exactly by how much. So the recommendation from ASCO, which is the American Society of Clinical Oncology, is that and the CDC for that matter, is that it's important for patients who have immunocompromised conditions to continue to wear masks, practice social distancing, use good hand hygiene, even after vaccination. Next step. Immunocompromised patients can receive the vaccine. So that's kind of straight from CDC. They can receive it. And with the caveats that I mentioned earlier. However, they do feel that household contacts should be vaccinated. So those that around you that are not immunocompromised should be vaccinated so you, if you will, are protected from your close contacts. Another common question about safety. Well, again, safety has not been formally studied in this group since clinical trials did not include these patients. And that's the long and the short of it. However, as you can see, all of the trials are, and actually all of the CDC and the sites that are immunizing people are following patients for serious safety issues. And to date, no safety issues have been seen in those vaccinated with cancer immunocompromised conditions. Next slide. So here's for patients who are undergoing cancer chemotherapy, this is in general guidelines when the vaccine may be given. But I preface this, I add again, talk with your doctor. Everyone's condition is situation is a little bit different. It's important to talk to your doctor oncologist. In general, we feel that 2 weeks before or after chemotherapy would be optimal. We don't have as much confidence with shorter intervals for the vaccine, but it still could be given. In general, most people feel that 3 months after allo, auto, or CAR T-cell transplants, because there just is very little immune response up until that time. They would consider deferral in grade 3 to 4 graft versus host disease because that condition often is associated with significant immune suppression. You can get vaccinated during radiation therapy or surgery. However, you may consider delaying 2 to 3 days before or after surgery simply because of the possible short-term side effects like fever, other types of symptoms that might actually interfere with assessment of surgery. You can get treatment during rituximab, interleukins, checkpoint inhibitors, IVIG, monoclonal antibodies, and maintenance oral chemo. At the present time, does not seem to significantly affect that, and there's no specific recommendations for delaying in those patients. Next slide. In general, and I'm talking about the general population, all of these vaccines are effective in preventing severe disease in the general population. And that's what we really are interested in, okay? The efficacy in preventing symptomatic disease does differ, but they're all very effective in preventing severe disease and hospitalizations and mortality. And that's what's important. So the mRNA vaccines are Pfizer and Moderna. They have an EUA from the FDA. Adenovirus vector is Johnson & Johnson or Janssen. Also has an FDA, but that's on hold. Next slide. And as you've likely heard on the news, it's on hold because of 6 cases, maybe a couple more. CDC is looking into it of cerebral venous sinus thrombosis, which is essentially a type of blood clot in the brain. Out of 6.8 million people vaccinated, an extremely low risk. Unclear exactly how it's related, but they're all were in women 18 to 48 years old within 2 weeks of the vaccine. It's likely that there will be some guidance by the end of the week. And I expect, obviously I don't know, but I expect that there will likely be some type of restriction or warning on this vaccine in the individual type of, or the group of individuals that was affected. Next slide. So the current vaccines, I think it's important just to remember the post-vaccine symptoms are pretty similar for all of them. The frequency might be a little bit different, but post-vaccine symptoms are mostly mild to moderate within 3 days of vaccination and resolve within 1 to 3 days. More severe following the second dose for the Pfizer Moderna ones, and for those individuals less than 55. So older individuals seem to have less of a risk of side effects. Local reactions are really common: pain, swelling, redness at the site, and then systemic reactions, fever, fatigue, headache, sore muscles, joints, etc., are still pretty common, but again, they generally resolve within 1 to 2 or 3 days. One point in cancer patients that's brought up is that some of these, particularly the Pfizer and Moderna shots, may cause enlarged lymph nodes in a small group of individuals, kind of regardless of whether you have cancer or not. And this generally lasts for 1 to up to 4 weeks. So in the cancer patients, it's considered to delay imaging. Like if you're having a CAT scan or other imaging to follow, let's say, lymph nodes that are related to your cancer, you might want to delay imaging for 4 weeks after the vaccine to let that effect from the vaccine subside. And so it doesn't confuse the picture from what your oncologist is looking at. Next slide. In general, for the vaccines, we try to observe individual for 15 minutes after the dose. The risk of allergic reaction, which was a lot of attention, anaphylaxis at the beginning, was actually very low for Pfizer Moderna, within about 10, 15 minutes after the dose. A few cases per million doses. Obviously, the recommendations, if you don't get this, do not get the second dose if you do have anaphylaxis. I don't believe any of these individuals were hospitalized, or if they were, it was very brief. For context, risk of anaphylaxis to penicillin is about 1 in 5,000 doses. Next slide. So when to avoid these vaccines, if you do have obviously allergy to prior dose of COVID vaccines, or allergy to PEG, polyethylene glycol, or polysorbate, they are related compounds, because the vaccines contain PEG for the mRNA, and then J&J contains polysorbate. So if you're allergic to them, obviously avoid them. You can still receive the vaccine if you have a prior allergy that's not related to vaccines, or a prior Guillain-Barré syndrome, which was a concern for other types of vaccines. However, there have been no reported cases with these vaccines. Next slide. As a lot of attention has been paid to the variants, multiple variants are identified worldwide. The ones that are concerned, UK, South Africa, and Brazil, all appear to be more contagious. There's only limited data on how the current vaccines work, but there's some data that the protection versus the South African variant may be a little bit less. Next slide. I can't see the bottom of the slide. Just a few questions, Dan. So should patients who have recovered from COVID-19 receive the vaccine? Yes, that's a general recommendation. You could defer it for up to 90 days because most people develop antibodies, but you can be vaccinated sooner. There's no specific timeline. Serology testing is not needed prior to vaccination. If you receive the COVID-2 monoclonal antibody or convalescent plasma, you should defer it for 90 days because those treatments last for a long time in the system, and they would interfere with, excuse me, the vaccine efficacy. Next slide. Does the vaccine affect diagnostic tests for COVID-19? PCR antigen tests that we commonly use will not be affected by the vaccine. The serologic test or antibody test may be positive depending on the assay, but it really depends. So your physician really has to understand which assay is being used. And again, testing for antibody response is not recommended after the vaccination. At the moment, we really don't know what to do with that information. Next slide, last one. Should a patient who's diagnosed with COVID shortly after the first dose receive the second scheduled dose? They should wait till the acute illness has resolved and they can discontinue isolation. And then last slide. Should a patient who is exposed to COVID-19 receive the vaccine in order to prevent the disease? No, there's no data to support that strategy, and it'd probably be too long to actually affect a difference in prevention. And I'll stop there and I'll take any questions at the end.
Oh, thank you so much, Dr. Revankar. We are going to keep we're getting some great questions in the Q&A. We're going to leave a good chunk of space at the end to answer those questions. So I'm going to turn it over to Martha, who's going to introduce Dr. Kraft.
Thank you so much, Noel. My name is Martha Latch. I'm the director of the Rogel Cancer Center's Community Outreach and Engagement Program with the University of Michigan. And I am so pleased to introduce Shawna Kraft to you. She has a Doctor of Pharmacy degree. She is board certified in oncology pharmacy. She specializes in oncology for genitourinary cancer, breast cancer, and melanoma at Michigan Medicine. And she's also a clinical associate professor at the University of Michigan College of Pharmacy. She teaches in oncology, pain, interprofessional education and wellness, and other areas of interest include immunotherapy, self-administered medication, and innovation in practice, including technology, herbal supplements, and wellness. Welcome, Dr. Kraft.
Thank you, Martha. Lovely to have everyone here. I get a lot of these questions every single day regarding the vaccine. So many things, and so many things we know today could change down the road. So obviously we're going to be presenting with what we know today, and that could change as we have more data coming out, as they will be studying, as cancer patients are receiving these vaccines. There will be data down the road of how everyone has done. Next slide, please. So got a lot of questions that people had submitted prior, which is fabulous to guide. So I tried to take some of that and then the patients that I see in my practice and questions that have come up. And I'll try and answer actually some questions I think that have come via the chat of while I'm speaking. So interactions. The good news is we don't have to worry about drug interactions that with any cancer medication. Whether it is an oral medicine, anti-hormone, immunotherapy, or chemotherapy. So there's no direct interaction of the vaccines themselves, whether it's the Johnson & Johnson on hold or the Moderna or the Pfizer vaccine. There's no concerns with those direct interactions. Similar to how we think about like the flu vaccine, it's an inactivated, we don't have to worry about like a live virus happening. So you can think a lot of with the COVID vaccine akin to the flu vaccine. One of the most common questions, particularly in the breast clinic that I work in, are hypersensitivity reactions and fusion reactions. In the breast cancer clinic, we give a lot of taxane medications like paclitaxel or docetaxel. I'm guessing many of you may have received, and folks may have had infusion reactions to it. And the infusion reactions are caused by polyethylene glycol, which is in the vehicle of the drugs to keep the drug stable to be given via IV infusion. So I have many patients who are very concerned that I had a hypersensitivity reaction when when I received my taxane. Should I get the COVID vaccine? Do I need to be worried because it contains polyethylene glycol? And the answer is no, not right now. I've worked quite closely with some of our physicians and our allergy team. We've had some other things with hypersensitivity reactions separate from the COVID vaccine, so we worked closely together. And when speaking with him, they don't know yet exactly why we've had the reactions to the vaccine that we have, but it doesn't appear to be related to polyethylene glycol for the type of reaction from COVID-19. If you have a true polyethylene glycol allergy that's separate and was determined completely separate from your taxane, I'm not talking about the infusion reaction. You had anaphylaxis. I have one patient I'm aware of who has an allergy to castor oil, which is polyethylene glycol. That person should not receive either the Moderna or the Pfizer vaccine. If J&J gets restarted or we have another vaccine approved that does contain the polysorbate 80 that was in the Johnson & Johnson, I would be comfortable with those patients receiving that. That being said, I have some patients who have polysorbate sensitivities. If they have a true allergy, again, then we can think about that if the vaccine has that in it. But if it's, again, just a hypersensitivity, it would be okay to receive it. If you have a lot of allergies, will I be allergic to the vaccine? No, not likely. So even if you're sensitive to other medications, you seem to react to a lot of things, it's unlikely that you would have a reaction that would say you're going to have a reaction to the COVID vaccine. As you can see, if you put it in the context of if you're going to react to a penicillin, much less likely. I think the reason I get this question so much is the vaccine's under great scrutiny. And so anytime a patient does have a reaction, it makes big news in the media when we hear about those things. So even if you're allergic to many different things, including penicillin, I don't suspect that you will have that type of reaction to the vaccine. If you had a bad reaction to the second dose, should you get a booster down the road? I'll answer this and invite any of my panelists when they're on there as well. I would say no. If you had a reaction, that probably means you're having an immune response, which is a good thing if you're having a reaction to the vaccine. Next slide, please. Will I have a response to it even if you're getting chemotherapy? So we know traditional chemotherapy, we are decreasing your immune system, right? We're doing some immunosuppression. It's just how chemo works, which is why we try and do timing. You heard before that you want to try and time it with that 2-week time frame. And an easy way to think about it also is if you're getting chemo and you get it every 21 days, try and get it, if you can, time it right before your next dose of chemo or a couple days before, because then your immune system will be at its highest. If you're receiving immunotherapy, that's a different story. We're revving up your immune system with immunotherapy, not suppressing it. So timing is not as crucial. And if you're receiving anti-hormone therapy, timing does not matter at all. Get it whenever you can. And will you get a response? So as we are guessing that maybe this was discussed previously with Dr. Revankar, that you may have a decreased response with chemo, simply again, because we're suppressing your immune system. If you're on other therapies, we suspect that you may have a regular response to other folks. And next slide, I think I have one more slide. And this was mentioned previously, what should you do on active treatment? When should you get it? Whenever you can. And then you saw the mention specifically, I pulled out, waiting at least 3 months. We have a lot of guidance here after treatment is complete. And this, again, a lot of the data that we're talking about when we're extrapolating this information is a lot from the flu vaccine and how we treat other vaccinations in cancer patients on treatment. We're extrapolating. The flu vaccine also needs your immune system to respond to it in order to be efficacious, in order for it to work. And so we're kind of drawing from what we know from the flu vaccine in cancer patients. So the take-home point is, get it if you can. There may be some timing considerations. Talk to your primary care doctor or your oncologist, if you still see an oncologist regularly, about if they have recommendations for specific timing. But otherwise, everyone should get it, and very minimal amounts of folks will have reactions to it or have a risk of a reaction to it. And I can stop there and go on to my next panelist.
All right, so thank you so much, Dr. Kraft. That was really informative, and thank you for answering a few of the audience questions as well. I'm next going to introduce our next 2 panelists, Brenda Chambers-Treat and Karen Edwards. Both Brenda and Karen are actually members of our Karmanos Cancer Institute's Office of Cancer Health Equity and Community Engagement's Cancer Action Council. We have many of these groups that are cancer survivors, caregivers, and advocates that are working to make change in their communities related to cancer and are building community capacity around research. So they're both going to share a little bit about their experience thinking about the vaccine and getting the vaccine as people who have been impacted by cancer. So Brenda, I'll turn it over to you first.
Hi, good evening, everyone. As Noel said, my name is Brenda Reed, and I am a 2-time breast cancer survivor. I also have type 2 diabetes and high blood pressure. So when They talked about the vaccine for COVID. I was so afraid that if I didn't get the vaccine, I would end up on a vent in the hospital and not come out of the hospital. So I signed up on every site possible to get the vaccine. And I was never afraid of getting the vaccine. I'm also one of those people, I get the flu shot every year. I received a shingles vaccine and also the pneumonia vaccine. I received the COVID vaccine in March, my first dose, and then 3 weeks later, the second dose. I did have, side effects from the second dose. I received the second dose on a Monday. By Tuesday night, I was feeling the chills, body aches, and a slight headache. So on Wednesday, I just sit in a lounge chair, recliner, and watch television all day long. And by Wednesday night, I was fine, back to my normal self. So I have been fully vaccinated as of April 12th. And just because I've been vaccinated, I still continue to wear a mask and I still social distance. So that is my COVID vaccine story.
All right. Thank you so much, Brenda. And we'll come back to you too at the end when we open up to questions, because we know that some other survivors and patients and caregivers may want to ask you some questions as well. So I'm going to, next, we're going to have Karen talk a little bit about her experiences.
Good afternoon, all. I am not a cancer survivor. However, I am a cancer advocate and I am also a cancer caregiver. I participate on the Karmanos and Wayne State University Cancer Action Council and the COVID Action Council. My experience with deciding about the vaccine is a little bit different than my colleague that just spoke. It took me a while to decide whether or not I should take the vaccine. And I think my experience is similar to a lot of people. I was nervous. The name of the vaccine was novel coronavirus. So I'm thinking, really, do they know about this vaccine? How much do they truly know? And I would ask questions to physicians. I've listened to the webinars from the COVID Action Council. I was listening to different people, but what I decided was I had to really go deep down in myself. I had to make the decision. I decided that I would do my own homework. I would check with credible references and people, physicians, my nephrologist. I didn't mention that I was also a kidney transplant recipient. And then I checked with the CDC, the Centers for Disease Control. I think as an individual, what we all should do is look within ourselves. We still have to practice safe distancing, wear a mask, hand washing, do physical exercises and activity so we can remain strong, be spiritual fit, mentally fit. I think staying in a positive mode or positive model, especially with the COVID-19. Many of us that are older or have other ailments, we're in the house. So I think it's good for us to stay positive, stay focused. And with all of that being said, I did decide after listening to my inner self to get the vaccine. So I have my first appointment scheduled, and I think it will benefit me. And I said, well, Karen, you're taking these medicines. I don't know what these medicines are. I don't know what their side effects. So I felt, well, I have confidence in the medicines that I'm taking for my kidney, for diabetes, for hypertension. I can take the vaccine. So that's how I came up with the decision that I did. And that concludes my story. Thank you.
Thank you for sharing, Karen. I'm going to have Martha introduce Megan Landry.
Yes, thank you so much to both Karen and Brenda for sharing bravely and honestly their stories. And I would now like to introduce one of our event partners, Landry, who is the Senior Manager of Cancer Control Strategic Partnerships for the American Cancer Society, where she's been for 7 years. In her role, she works directly with health systems, health plans, federally qualified health centers and health departments on cancer prevention and screening, as well as supporting cancer patients. Megan.
Hi, everybody. Thanks so much for having me on here. I just cannot help but look outside my window and see that snow. So thank you for coming on this chilly Tuesday evening. So really, I'm just here to share some resources that the American Cancer Society has. Right when you go to our website, which is just cancer.org, and I can type that in the chat, you'll see a little yellow banner across the top that says what patients and caregivers need to know about cancer, coronavirus, and COVID-19. If you click that, it really takes you to our COVID-19 hub, where we have up-to-date, evidence-based, science-based information. So what you can find there is common questions about COVID-19. We have statistics. We have information about cancer screening during COVID-19, which I'm going to talk about in a second. Questions to ask your healthcare team about COVID. And then we have information on the vaccine with people with cancer. We have a lot of information on ACS CAN and the advocacy work that we've been doing to help individuals during this time. So there's a lot of information on there, and it's all in that one hub. So it's just kind of a one-stop shop to go get it. I also just wanted to share our phone number because it's 24 hours, 7 days a week. If you call, someone will answer and can help direct you to some of these resources. And again, I'll type this in the chat too, or maybe my colleague Jane can type in the chat if she's available. But the number is 800-227-2345. So going back to cancer screening, that is a really big initiative for the American Cancer Society right now. As you can imagine, cancer screening was delayed in the last year. Offices weren't even open, and then individuals were tentative to schedule their screenings. So we're asking individuals to get back into their screening, call their doctor, get scheduled, talk to them about the safety procedures that their office is following if you're nervous about that. If you have been screened, we invite you to share your story. That's a way that I've gotten some of my friends screened. My mom went in for a skin cancer check during COVID because when I was FaceTiming her, we were all FaceTiming more, I think, in the last year. I noticed that she had an age spot that was getting really dark. So I mentioned it to her and she thought it was fine, just the age spot, but she went in and it ended up being melanoma. It's stage 0, but she did have to have surgery and then plastic surgery, but that is all much better than the alternative. If she had waited, it would have grown and potentially may have been a later stage. So I shared my story on Facebook, and I've had like 4 or 5 friends just reach out to me and say, because of you, I went to get my skin check. So the power of our stories of just sharing, hey, I went to get screened and I prevented cancer is really important. And then we have some social media messages too, which Karmanos has been really great about sharing and posting for us. So that's really all I have. Just really quick, wanted to share some resources that ACS has.
All right, thank you so much, Megan. And Rosie, I think, is next. Martha, do you want to?
Yeah, I'll step in and introduce Rosie. We're really fortunate to have the partnership of both the American Cancer Society and the cancer support community for this program. So I'd like to introduce Rosie Ingebritson. She's an oncology social worker and the program director at the cancer support community at Greater Ann Arbor. It's a local nonprofit providing free support services for those with cancer and their loved ones. And she says she's privileged to work with patients, survivors, and caregivers in both individual and group settings. Her practice interests include health and mental health equity and patient caregiver communication, as well as elevating patient voices in healthcare. Rosie.
Thanks so much, Martha, and thank you. It's such a privilege to be here with these colleagues from these fantastic organizations. So thank you all so much for having me. So as Martha said in her introduction, I'm the program director at the Cancer Support Community of Greater Ann Arbor. I'm going to be facilitating Q&A here in a moment as well, and we've gotten some really fantastic questions that I know we're eager to get there. I do want to just take a couple moments to address the sort of mental, emotional, and social impact that COVID-19 has had on all of us, and particularly on people dealing with cancer. because that's a really important piece of this. And just like mental health and cancer care, it's one that we want to take really seriously. So I know that I'm feeling a lot more hopeful these days than I was, 6 months or a year ago. And I think that's true for a lot of people. There may still be some questions about, getting the vaccine, but, as more and more people get it, there's a lot to feel hopeful about. But I think it's also important to just acknowledge that we've all been through something really traumatic in the last year as a global and local community. This has been really a challenging, traumatic experience. And so making that transition back to quote unquote, normal life isn't necessarily going to be just a flip of a switch, right? It's almost certainly not going to be. So I'm reminded when I think of this of the transition to life after cancer treatment. I often hear from folks in my support groups that, there's sort of this expectation that you're just going to go right back to normal life and just be totally okay. But in reality, you might feel like a different person. You might have different needs now. You might look at the world and at safety a different way. And so as you are, if and when you do get your vaccine and you're taking those steps to, to feel a little bit safer in your community and in, and in your life, it's also okay to take your time, to take those steps slowly. The vaccine isn't going to be the fix all, as we know. It's a huge, wonderful step, but we still need to be wearing masks and distancing, and those things aren't going to go away overnight. So just continue to take care of yourself mentally and emotionally as you make that transition. That's probably going to be a slow and complicated one. So I just wanted to mention some of the free support services that are available for folks dealing with cancer that are here that have been here throughout the COVID-19 pandemic and are available via video conference. So just like this, there's support groups and educational programs similar to this one available for folks really anywhere that can access these things, both through my organization and our wonderful partner organizations at Gilda's Club Metro Detroit and Gilda's Club Grand Rapids. So I just wanted to touch on that really quickly because, like I said, this transition time to life when the vaccination is available isn't going to necessarily be a flip of a switch. It's going to be something you might still need help with, and getting some support around your cancer is a really great way to do that. So the resources available include things like professionally facilitated support groups, educational workshops, healthy lifestyle and stress management classes. So things like meditation, yoga, cooking and nutrition, things that really impact your coping with cancer. They're available for patients and caregivers. We also have social events, which I think now being able to do that virtually is more important, in the last year has been more important than ever. So to access any of these, to visit the Cancer Support Community of Greater Ann Arbor, that's the organization I'm with, you can visit www.cancersupportannarbor.org/virtual. To find Gilda's Club of Metro Detroit, visit www.gildasclubdetroit.org. And for Gilda's Club Grand Rapids, visit www.gildasclubgr.org. I know we've all been moving through this content really quickly, and I am doing the same because I do want to get to our fantastic questions that we have had come in. But I guess I'll just close by sort of reinforcing that reminder to take care of yourself, give yourself some grace as you handle navigating these social and emotional changes that have come with COVID-19 and with cancer in particular. I think it's been harder for the cancer community than for almost anyone. It's really been quite a struggle because you're dealing with these double traumatic experiences at the same time. So we're in this together, and I hope that you'll always reach out for support. I will chat those websites into the, someone just asked, yep, I will chat the websites into the chat. And I'll also put my email address in there. If you're closer to one of my colleagues in Grand Rapids or Metro Detroit, I'm happy to just send you their way. Although right now, all of us, I think, can see folks from anywhere because we're operating virtually. So we're here to offer that support, and we would love to see you on Zoom. So I'll type that into the chat while we get going with questions. But I think I will go ahead and turn it on over to Q&A. Shall I just go ahead and take us into the first question? Okay.
Yes.
Perfect. So I think a lot of the questions that we're hearing about in our community, and what I'm trying to do here is sort of put some of these questions together because we're getting a lot that sort of overlap. A lot of the questions we're hearing about in our community, in addition to the safety of the vaccine, is what's safe for me after I'm vaccinated. So we got a lot of different questions to that effect. Things like, is it safe to go, if I'm vaccinated and I'm a cancer survivor, is it safe for me to go outdoors to restaurants? Is it safe for me to go indoors to restaurants? Is it safe for me to socialize in the home with how many different households? Things like that. So if you all wouldn't mind addressing a little bit about what's safe to do once you are fully vaccinated after that 2 weeks after your second dose, that would be great.
Yeah, I can try to address that. That's a kind of a complicated question because cancer survivor, there is no one cancer survivor. So I'll just comment that once you've been vaccinated, there are different recommendations based on where you live as to what you can and can't do or what's recommended. CDC has put out some guidance about you can visit with other families who have also been vaccinated and who have members in them, if they have not been vaccinated, who are at low risk, like small children. I will tell you that that's for the general population. If you have had recent chemo or if you're immunocompromised, and again, I'm going to refer you to your oncologist who would be able to tell you how significant that is. That would be risky. And I think most of the recommendations are not for immunocompromised patients. And I'd say I'd still follow the normal precautions that we would do. That's the general recommendation. There is some discussion in the cancer organizations that cancer survivors, meaning those that have been a number of years out from the therapy, without active cancer and not on active immunosuppression, probably can do these things like I'll say, individuals without cancer. The farther you are from your cancer and you're not on immunosuppression, the more likely you are to be safe doing those things. But if you are in active therapy, I'd say continue to follow the precautions, masks, social distancing, etc. I'll just make one more comment about, I got a question about, there's some study that 17% vaccines are 17% effective in immunocompromised patients. That actually, that study, there's only one study, was out of Johns Hopkins, and they looked at all the solid organ transplant patients and found, and did antibody testing and through their own lab, and found that only 17% of their solid organ transplant patients responded to the vaccine, at least by antibodies. So clearly in the transplant population, the response is not going to be very good. And so there's just kind of a highlight warning in that situation. So I think you just have to be cautious, and the more you're immunocompromised, the more you have to be cautious.
Thank you. That's great. Dr. Kraft, did you want to add anything to that?
No, but like you said, it's very tricky because not everyone fits into a box. Not every cancer patient undergoing active treatment, not every survivor is in a box to just give a blanket answer, which I know can be very frustrating. But I know many of the providers I work with are trying to be very clear when speaking with patients about what your level of immunocompromised state is. So I would say ask if you're not sure.
Thank you. Yeah, I get the sense that I am probably going to be asking some tricky questions here. So we appreciate you doing the best you can. I know you all won't necessarily be able to give perfectly clear, set answers for all of them because it's all new stuff. So someone asked, you talked about being farther out from chemotherapy or from treatment, your immune system is going to be coming sort of back online. So how long after chemotherapy, someone asks, are you generally considered immunocompromised? Is there a standard time?
Yeah, that's another great question with a not so great answer. We see a lot of patients in the hospital, in the cancer center at Karmanos, and I'll tell you, there is no one cancer patient that is like another, really. So how long after the end of chemo are you considered immunocompromised? Well, the simple answer is depends on what kind of chemo you're getting. Okay, so some chemo for specific things will make you significantly immunocompromised for months. Others probably for a few weeks, and others maybe after 2 weeks, your immune system would have mostly recovered. So this is an example where you really have to talk to your oncologist about how they feel about the response, how they feel that your immune system would be able to respond after the particular chemo. There was another question about whether how soon afterwards, after you got the COVID vaccine, or how soon after you were exposed, should you get tested before starting chemo? That's a better question. The general answer is the CDC has narrowed that window to about 4 to 7 days. If you've been exposed and you're negative after about 4 to 7 days, that's generally okay. But if you're undergoing pretty significant chemo, or you're going to be immunocompromised severely, most people might wait a little bit longer to make sure you don't develop symptoms. And the important thing to remember is the incubation period for COVID is 2 to 14 days. So it's a pretty long window, and I think that makes it difficult to make really, concrete answers about questions like that. Again, it depends on what you'd be undergoing. If you're undergoing chemotherapy that is not expected to impact your immune response that much, then maybe it's not going to be as much of an effect as if you're undergoing chemotherapy for, let's say, leukemia, which would be very severe and put you at risk for much longer.
Thank you. So it sounds like the important thing is, if you have been on chemo, to talk to your doctor about how long you're immunocompromised, because they would be able to answer that specific question based on your own treatment, right? And someone had asked if blood counts are solid indicators of how your immune system is functioning.
To a degree. I mean, I think that the blood counts that we look at commonly for most types of chemo are your neutrophil count, and then maybe your lymphocyte count. It's a little tricky to give a number to say that you're okay with. I'll say that, let's say, for treatments that make your neutrophil count go very low, once it gets above 1,000, let's say, that is a good indicator that your immune system is recovering. It does not mean it's back to normal, but it's recovering. And at that point, maybe makes sense to consider getting the vaccine. If you're going to get more chemo, the time to do it is when your immune system has at least recovered somewhat. Again, that's very individual. Some patients will have just 1 or 2 cycles and that's it. And others will have, continual cycles. And so that makes it very difficult to schedule vaccines when there's no clear endpoint of the chemotherapy. And that's where the individuality of the therapy comes in.
That makes sense. So, oh gosh, we have so many good questions. Okay, I'm going to try to get through as many of these as I can. So someone says, as they understand it, the vaccine doesn't necessarily fully prevent COVID, but it lessens symptoms, right? It lessens the likelihood, it prevents severe disease. So for someone with cancer, are there symptoms? Will the COVID, I'm trying to read this right. Will the COVID vaccine be able to prevent severe disease at the same rate, or prevent symptoms at the same rate, or will it be reduced?
In patients with cancer? Yeah, I mean, all I can say is that it really does, the vaccines really do prevent COVID in many people. For others, it just gives them, let's say, a milder disease. And in a very small percentage, they may, quote unquote, break through and have severe disease, become hospitalized. But the overall risk for that is actually very, very low. In patients with an intact immune system, if your immune system is compromised, it's very difficult to get a clear answer, give a clear answer on it. I think it depends on how severe it is. I mean, immunocompromised. The more it is, then the more your likelihood that you may not have as good a response to the vaccine and may get more sick from it. So that's the simple answer there.
Great, thank you. So one person had asked, this is back to safety, and I know you're probably not going to say yes or no, but they had asked about the safety of spending time. So if they're fully vaccinated and they want to spend time with other fully vaccinated people, is that safe? And then what if those fully vaccinated people they're spending time with are in high risk environments, like maybe they're going to restaurants, or they work in a supermarket, or they, just generally are less precautious?
Yeah, I'd say the safe thing is to wear a mask and stay 6 feet away. Okay, so if you're immunocompromised and you got the vaccine, there's a reasonable chance you're not going to be as protected. And then when you see someone, even if they've been vaccinated, and what we don't really understand for some people is that if they're vaccinated, they may still be able to shed the virus and give it to other people. That seems less. We have data that it is less than normal, but it's still possible that they could shed the virus and you could get it from them. So, much as you'd like to say that, I think you still need to be cautious because you still could be affected. And the more immunocompromised you are, the more cautious you have to be. I'll leave it at that. And hopefully we come to a point where there's enough herd immunity where the overall risk is so low that you actually can do that. I'm saying that yes, we will get there. I don't know exactly when though.
Yeah, a lot of fingers crossed there. So a lot of people had questions about sort of like, is there data on this or on that? And I think a way to sort of summarize all that is where can patients be looking for information that's going to be reputable? Like what are a few sources that we know are going to be safe and good, reputable medical information on COVID?
Yeah, that's the boy. Yeah, I think that is a very good question. I'd say that the CDC website is actually quite good. I'd say it's very up to date. It's not like hourly up to date, but it's very up to date. And it does have a section on patients where they do talk about patient issues and concerns in language that is not as medically terminological, if you will. NIH also has a website, as does ASCO, which is the American Society of Clinical Oncology. That may be a little bit medical for most people. I'd say the CDC website and go to the section for patients, and I think their explanations are quite helpful and reasonably up to date.
And I would just jump in and say the American Cancer Society website is pretty easy to read too. And it's just cancer.org. And again, that banner at the top will take you to our COVID hub.
Great, thank you.
Thank you, Megan, too. I would also add to that, whenever I'm trying to offer good websites, a good way to remember it is cancer.org, which is ACS, cancer.net, which is the ASCO that we just heard about, that's the patient version, the patient-facing version of ASCO, and then cancer.gov. So that's like a nice, clear way to remember. Cancer.org, cancer.net, cancer.gov. So, all right, let's see. I think I've got time for, what do you think? 1 or 2 questions more? Okay. So let's see. I'm just going to try to pick the ones that are like most applicable to everyone. So you know what, I actually think it makes sense to take this out to the whole panel now. And I guess, it seems like the summary of all the questions that were coming in is what is safe for me to do after the vaccine and what makes the vaccine safe or not safe for me personally. So I want to make sure that we have time to sort of like get any closing thoughts we have on that because we have such a wealth of minds here. So maybe I'll put that out to the whole group and say, is there anything you want to add in terms of safety after being vaccinated and safety of the vaccine?
I'll be quiet for a bit. Let someone else talk. Go ahead. Anyone else want to say?
I'll say that I got the vaccine. My husband's gotten it. My parents have gotten it. I encourage all of my patients to get it. And anyone who can get it should get it. So if that's, the minute I could get it, I was begging to get it. So yeah. I don't know if that helps at all. Like, I feel very comfortable with the safety of it. I know folks are concerned because it seems like it's gone through a very speedy process compared to other things, but actually it's very well regulated. And even though we're hearing about these side effects, if you compare them to rates of other things that everyone is taking, it's so incredibly low. I think I even heard the statistic, it's more likely you're going to get struck by lightning than some of the side effects that are being reported, if that puts it in perspective.
Yeah, I'll just echo that. And I think that the safety in cancer patients is always a concern. Like I said at the beginning of my talk, there's not a lot of data there. There's actually only one study specifically in cancer patients out of Israel that got checkpoint inhibitors. And they found that the only difference was that the patients that were getting the immune checkpoint inhibitors had somewhat more muscle pain than the other patients that got the vaccine, but it was also self-limited and really didn't persist and was not considered serious. So that's the only formal study. Like I mentioned, The CDC, et cetera, is on the lookout for any kind of signal for side effects in all these vaccines. People are reporting them. That's how you get the allergic reactions that came up. But at the moment, from the CDC, there is no signal that cancer patients or immunocompromised patients have any worse reactions to the vaccine than anyone else. So I would encourage them that if it makes sense, talk to your oncologist. Obviously, we do feel that these are safe and effective. I take it back. We do feel that these are safe. Unclear how effective they are in patients with cancer. Okay, but I think I would encourage you to get it.
You know, I think what I'm hearing in our community too, from folks who have gotten it, who do have cancer and are in treatment, is, you know, okay, we're accepting that it might not be as effective, but we're glad to have any extra protection, right? So if it's 5%, if it's 50%, if it's 95%, it's better than nothing, right? If they are safe, which it sounds, you know, like you all have really reinforced that they are. So yeah, I guess I should turn it back over now. Noel, do you want to tag back in and I'll turn it over to you?
Yes. Yep. I just want to share one thing. We do have some additional resources, and I know one of my colleagues, Shawna, is sticking them in the chat. But we have on our website, and we will send this website out as well, a general COVID resources, some information on vaccines, and then some additional information with links about how to schedule vaccines. So people are still looking for wanting to get some vaccines scheduled. So we have one final poll to do. This one's even shorter. It's just 2 quick questions. So we really appreciate everyone. Okay, sorry, really appreciate everyone taking the time to answer these last 2 questions. So I'll launch that poll. And then maybe while people are filling that out, I know Martha is going to turn it back over to Martha to, you know, say some final words, but we'll give people a minute or 2 to complete this. And again, I just want to really thank everyone who shared today. It was very informative, and we will make sure to send out the link to rewatch this webinar or forward it on to other people that you think could benefit from this information. And thanks again for taking these polls.
All right, so just come back in to thank everyone, and please do finish that poll, just those couple of short questions. But I'm so grateful we were able to fit so much in. We really packed this hour, and hopefully you'll be able to view the recording if you want to review all the great information. I want to give a special thanks to Drs. Revankar and Kraft for their expertise, and also to our providers of such wonderful, brave, inspiring stories, Karen Edwards and Brenda Threet. We really appreciate that. And then, of course, Rosie for adeptly handling our Q&A, and the American Cancer Society for being here, providing resources. We're really pleased that you could join us in this jointly planned event. Educating the community virtually about this topic is so very important during this time when we can't gather physically. So we're really very grateful that we could join together. So thank you so much for sharing your stories and your time with us, and we hope you have a wonderful evening. Take care, everyone.
Yeah, thank you so much, everyone. Have a safe night. Bye.